Great, thank you. Great. Kalimara, good morning. I'd like to thank President Anthopoulos of the Organizing Committee and President Leolos of the Scientific Committee for inviting me to your conference to speak. I've actually spoken twice before at your conference, and I always appreciate the opportunity to come back and visit your lovely country. So today I'll be speaking about the use of advanced practice nurses, which we have had in the United States since 1960, and we have been developing this role in many specialty areas. And today I'll speak a bit about the role, keeping in the theme of our morning session, of the role of the nurse with dealing with neurosurgical patients and brain-injured patients. In the United States, as well as internationally, the International Council for Nursing has recognized advanced practice nurses as nurses who extend their education. They focus in on a master's degree educational level and really obtain advanced knowledge and skills in order to work in conjunction with physicians to help manage patients. Particularly in the intensive care unit, we have acute care nurse practitioners that help to manage patients as part of the ICU team. Many of them have different roles. Some may work with the ICU team to help manage patients, and some may be service-based, so they may work with particular services and round only on those patients. They do have many roles. They are involved in direct patient care management. They do have some skills that they learn not only in their master's degree, but after they begin employment in the intensive care units. And in addition to assisting with patient care, they may have a set of patients that they do care with in conjunction with the physician, but they also work on quality improvement projects. So maybe targeting reduction of ventilator-associated pneumonia by having the nurses implement oral care protocols, or making sure that guidelines are instituted on all patients in the ICU. They also have a role in educating nurses at the bedside, as well as patients and families, and some of them are involved actively in research. So their role is really at the advanced level, hence the name. We had the opportunity to conduct a synthesis literature review several years ago, myself and several colleagues, and we looked in the literature to see what research had been published on the use of nurse practitioners and physician assistants. We also have another level called a physician assistant in the United States, and so we conducted an evidence-based review. In this literature review, we focused in specifically on their use in the intensive care units, and we found that there were 145 articles that were published, and 30 of those were actual research studies. Of those articles, we focused specifically on those that address care of nurse practitioners. And out of the 28, 19 were focused specifically on the role of the nurse practitioner. And we found through this review that the acute care nurse practitioner was practicing in a variety of settings, including not only general ICUs, but also emergency departments, trauma units, and again with specialty patients, working with the stroke team or working with a team of neurologists or working with neurosurgeons, as well as working in other care areas such as pulmonary and general critical care. In terms of practice settings, as shown here, majority of acute care nurse practitioners in the United States are working in general intensive care units. Others are working in specialty areas. Now, we have had in the U.S. the role of the nurse practitioner since 1960, and the original focus was primary care. The role was actually developed to work with pediatric patients when there was a shortage of pediatricians. And since that time, the role has really evolved to a number of specialty areas. The most recent has been the acute care nurse practitioner. So we have had nurse practitioners working in the ICU for about 15 years now in the United States. The roles of nurse practitioners in the ICU, as I mentioned, can be involved in direct patient care management. So they'll do such things as assist with obtaining the history and physical exam. They may have a set of patients that they follow in the ICU to do their assessments, to do their management in conjunction with the physician. We have collaborative practice agreements, so they work in conjunction with the physician most often. They may be involved in implementing protocols. In all of our states, the nurse practitioners have different levels of prescriptive authority, so they may be also involved in prescribing medications, and sometimes this is based on, again, collaborative agreements. They're also doing some procedures. Some of the nurse practitioners are credentialed and privileged through the medical staff office as our physicians to do certain skills, such as suturing or line insertion, but it really depends on their level of training and, again, their level of supervision by physicians in doing some of these skills. They're also involved in some specialty work, such as nutritional care, and also, again, as I mentioned, educating and really communicating with family members and the patient. And that aspect of education has been beneficial, particularly for communicating the plan of care to the nurses at the bedside. They're also involved, as I mentioned, in implementing protocols and also in leading initiatives such as implementation of initiatives and bundle care. Some also serve in specialty roles, such as palliative care. We have nurse practitioners who work specifically in that area, but all of them really work on enhancing collaboration and team in the ICU. Discharge planning is another area of their focus, and as I mentioned, also research. Some of the literature, I just want to share a few studies with you that pertain to the role of the nurse practitioner in neurological care of patients in the ICU. And this was a study that was published several years ago at the University of Virginia in Charlottesville. And they did a review of the role of a nurse practitioner after the nurse practitioner had been in that role for 6 months. And they compared patients prior to that time to patients that the nurse practitioner had helped in managing during that 6-month period. And they developed a worksheet that every day they would round with the team and address certain areas of care for patients, particularly respiratory care, pain management, and then also nutrition care. And what they found in this study, as shown here in gray, are those patients that were managed or assisted to be managed with the acute care nurse practitioner in conjunction with the physician team. And they found that during the 6 months that the nurse practitioner was in her role, they had a decrease in urinary tract infections, and this was really by rounding again on patients and discontinuing Foley catheters for those patients who no longer needed them. They had no incidence of skin breakdown during that 6-month period, again reinforcing turning and practices with the nurses at the bedside. And they also had a decrease in pneumonia. Although not statistically significant, you would agree by the change it was certainly clinically significant. So this is an example of the outcomes that this institution experienced by having nurse practitioners work in the neuro ICU. They also found that they were able to discontinue the Foley catheter most frequently in these patients over that time period, and that was significant. And they also were able to mobilize patients or get patients out of bed sooner. And that's actually a focus that we have in the United States currently, is early mobilization to prevent complications. The other areas in terms of length of stay in the ICU or time that they were on the ventilator or having a tracheostomy were not significant, but did show some changes. So the results, they identified that patients who were managed by acute care nurse practitioners had a shorter length of stay, both in the hospital. They had lower rates of urinary tract infection and shorter time to discontinue their catheter and, again, be mobilized out of bed. They also looked at the number of the impact of the team and found that the fewer days that they were hospitalized in the ICU resulted in a significant cost savings to the unit as well. So they concluded that clinical and financial outcomes were improved for having nurse practitioners help to manage, along with the physician team, patients in the ICU. One of the organizations in the United States is the Brain Attack Coalition, and they have designated guidelines for patient care, and particularly for stroke patients. And they recommend that at least one advanced practice nurses be involved in care of patients on stroke teams. And many of our stroke teams do have an advanced practice nurse. This comes specifically from their guidelines that state that advanced practice nurses are especially beneficial when it comes to developing stroke care protocols, research, education, quality assurance, and other areas of care. And this comes specifically from that guideline that was published in 2005. And they highlight that among the team members, an advanced practice nurse ideally should be a member of the team. And they recommend at least one advanced practice nurse be part of a comprehensive stroke care center. I mentioned the idea of collaboration and communication, and that is one of the key roles of our advanced practice nurses. They really serve as a leader in the unit. They really serve to help communication between the members of the team. And some research has actually focused on this area of communication skills and developing that communication skills. So learning to be a team member and really, communicating between members of the team. This particular review identified the role of the nurse practitioner in communication and focused in that in this particular review, they found that there were studies where patients were more satisfied when an advanced practice nurse was helping to manage care. They also found increased adherence, so patients were more compliant. They had more information about their plan of care, and overall patients reported better health. So the literature does show benefits of this role. One of the other areas of focus, this study focused in on interviewing physicians and nurses on their impressions of having an advanced practice nurse in the ICU. And they looked particularly at the idea of, again, this team collaboration. And they compared that to a unit that did not have nurse practitioners. And what they found was in comparing the role of the nurse practitioner along with the medical director, particularly for the area of rounds. And in their study, they found that physicians in the intervention group, or those who worked with a nurse practitioner, reported higher collaboration compared to the control unit. And they also had higher collaboration with the nurse practitioner. So they concluded that a multidisciplinary intervention with the use of nurse practitioners resulted in better communication and collaboration, so that team effort as well. Most recently, our national American Association of Critical Care Nurses has designated what they call a healthy environment framework, so really promoting a positive work environment. And they identify the role of advanced practice nurses in promoting this healthy work environment in the ICU, where we function as a team, we have open communication, we collaborate as a team. We also focus on decision-making for the patient, what's best for the patient, what do we know the family preferences are, what are the patient preferences, what is the staffing for nurses, is that adequate? The advanced practice nurses help to advocate for that, as well as looking at recognition within the unit of the team, and leadership. And this is their model, just to show you the different components that they focus in on, particularly for promoting positive patient outcomes. I wanted to share a little bit about our experience at Rush University Medical Center. We are an academic facility. We have 650 beds, and we have a designation that's considered prestigious for the nurses. It's called magnet designation. Less than 5% of all U.S. hospitals have this designation. And we do have a predominant amount of nurses who have their bachelor's degree.
My name is Amy Green. I am a clinical pharmacist at Rush University Medical Center. I've worked here for 7 years, and I've been able to witness the vital role that the nurse practitioners have played in the care of our patients in the neuro ICU, and also as our patients transition out of the neuro ICU. We do have a nurse practitioner that works with the neurosurgery residents on the floor and collaborates on care of those patients and really pulls together all the gaps that the neurosurgery residents are not able to do throughout the day. I like the interactions that I have with their role on those patients. Also, we have nurse practitioners
But I do want to highlight that, I've talked about all the positive benefits of it, but it is a challenge. We have struggled with getting acceptance of the role over the years. This is an article that was written addressing the role of the acute care nurse practitioner in a neurosurgical unit, and they spoke about their experiences in 2 different institutions, and they highlight that they too have faced barriers to implementing the role. In terms of clarifying the role, there's a misperception that the nurse practitioner is doing physician skills where they're really not. They're collaborating with the physician. Acceptance by others, lack of administrative support, and inadequate preparation are things that we still struggle with in terms of indicating what the true role is to help patient care. And it's not just in the U.S. I'll close just by highlighting this last study from the United Kingdom, where they looked at the perceptions of 104 physicians and nurses, particularly looking at the nurse practitioner role in the emergency department. And they highlighted that while there's a number of benefits, including addressing patient care and improving satisfaction and staff morale and promoting safety, there's also been some barriers. One physician quoted, "I certainly believe there are nurses out there ready to take on this type of role if the supervision and support is there. I don't see a reason why it shouldn't be happening, but you can't do anything without support of senior managers. They need to be on board first. If they push it, then certainly it should be encouraged and supported on the medical side." So they found that there was some confusion between the role, and that needs to be addressed, particularly prior to introducing the role into the institutions. So in summary, I just wanted to share a bit with you about our experiences with the role of the acute care nurse practitioner, and particularly how they can enhance team-based care by working with the physician team. And through appropriate supervision and training, they really have impacted our patient care. So thank you so much for your attention.
Thank you, Professor.